what we'll be focusing on is how to grow Ontario companies. I've talked about Catalyst. I said we're not going to just create another entity that sits alongside the others. Part of that will be leveraging the good work that's already happening, and there is a lot of it. It's so impressive to me as a taxpayer, as a healthcare professional, as a parent, to see how many passionate, smart, hardworking people we have in Ontario at the hospitals, at the universities, at the regional hospitals, at the colleges, at Mars-related entities, at government-related entities, at places like Venture Labs and Markham. Everywhere we have people trying to crack this nut, and that together with the government focus and all the great assets we have in Ontario already, including the GTA, a city in which the world wants to live, and it's the 4th largest market in North America if you include Mexico City. You put all that together and there's going to be a tipping point on this stuff. So by leveraging what's already working and seeking to make the whole greater than the sum of its parts, I truly believe we're going to move the needle on this. I've talked about measuring ourselves by impact. I've talked about our focus on creating jobs in Ontario. Part of that will be driving exports. So Ontario is a big Canadian market, small global market, but the massive potential, and we've heard this from companies all along, of being able to market within what is in effect a $52 billion business, the largest HMO in North America. The impact of being able to say that you're selling into that market is massive. And so for these Ontario companies that right now can't penetrate the Ontario market, if they ever could, use that, our province as first customer, hospitals, healthcare providers as first customer, evidence generated within this province and that system, that is powerful commercial material, and we look forward to providing that support for those companies. The last two cannot be overlooked, and I left them at the end not because they're least in importance, but they're so foundational. We really are going to champion the move along, frankly, with many colleagues in health ministry now to value-based care. Part of that will also be outcomes-based targets. We're really going to try to talk about a holistic approach that sets a metric out in the future and then lets the industry and ideas and marketplace provide solutions for us, not abdicating our responsibility as the public body delivering healthcare in Ontario. We're not talking about that, but really getting out of the way and letting the private sector work with the public sector to give us the ideas that will create the best 21st century healthcare system. And patients will be at the center of that. Patients will be at the center of that. Again, as a taxpayer, it's frankly kind of thrilling to hear how often at the executive table patients are the topic of conversation, and I think that's great, and we're not going to be any exception to that. I just wanted to give you one example of one of the pieces that we're going to work on in the priority on pathways. I'm not going to give you all this detail, but many of you in this room will know the exciting work that's being done at Mars Excite, and you will also know that it's been working at its task for a number of years, and we're looking forward to the first product coming out of that system. One of the things that I think presents incredible opportunity for us in our role is to build on that Mars Excite value proposition, which looks at how do you really accelerate the adoption of breakthrough or disruptive technology by providing early evidence input or early input into the evidence that's required to get those companies into the Ontario marketplace. That value proposition is potentially really powerful. And working with Mars Excite and colleagues at HQO and OTAC, as well as the ministry itself, we're really looking forward to building a process that through the course of this year you'll hear more about, that really looks at taking that value proposition to the next level and seeing how we can get these breakthrough and disruptive technologies into the system, and by doing that also help identify the true priorities for technology and outcomes that we're looking for at the Ministry of Health. The Ministry of Health being involved in that process, in the development of that type of a prioritization exercise that would give early input into evidence required by these companies and have them come out the other end into the Ontario marketplace, as I said, has immense potential and is really exciting. And to the extent that we can get a system for prioritization, really focus on speed of execution, implementation, including doing some of that in parallel work with the full involvement of the ministry with its partners is the kind of thing that is one example of the kind of thing that we can do as a result of this role. And focusing on pathways and prioritization, some of that other work, I think gives us a real chance at realizing, achieving those objectives and meeting those expectations that Neil's committee, the OHIT Council, set for us about a year and a half ago. And I'll finish where I usually begin by saying I love this job. I love this job, and I'm really excited by this. And it's an absolute pleasure to have been given this role, and I look forward to talking about it with you. Thanks.
Okay, before we get to the questions, I note there are 10 people standing along the wall. There are seats if people want to help you get to them. It's fine if you want to stand, but, and I know it's good for Longwoods to say standing room only at our gathering, but sometimes people like to sit, so I'll give you a chance to do that. Before we get into the question, I'm reminded of something I was involved in over 20 years ago, which was the first tender to wire together then 2,500 pharmacies to support OHIP in real time. We were being defrauded by some fleet-footed people that were able to take the same prescription to multiple pharmacies, and we wouldn't discover this until a month later when the paper bills came in. It was the RCMP who came to me and said the ODB is the largest source of illegal, legal drugs in the country, and you might want to do something about that. We tendered. A little Ontario firm called Systems Excellence won the tender, as headed by a very good entrepreneur and brilliant software engineer named Malcolm Rigby. Took me 5 trips to cabinet. Graham's here, he'll know that after 2 trips to cabinet, it's viewed as career limiting, but of course if you're deputy of health, it's more like a 5-year survival than a career, so I kept going. And their last question was, IBM bid, other big companies bid, how come this little company is winning this $75 million contract? And I said, well, when Malcolm Rigby was with IBM, he was Software Engineer of the Year, and now he's with Systems Excellence. I presume if he hadn't changed companies, that IBM would be winning it. Here's the sort of bittersweet news. They did a brilliant job. We saved more money in the first year than it cost us to automate it. It saved, having them in an electronic form has saved hundreds of millions of dollars over the past 20 years. Systems Excellence didn't scale, eventually drifted off to the States, grew, transformed itself into a PBM, eventually changed its name to a company called Catamaran, and was sold last year for $12 billion. So, you know, if you need to believe that all of this can result in a lot of jobs and value creation for Ontario, there's the one that got away. So with that, I'm going to ask one question to the 2 panelists, and then we're going to open it up, and that's, and it's a provocative question, are we closer than we've ever been? Neil and Bill.
I'll go first. I think that, you know, you always say in engineering that half of defining the problem is halfway to the solution. So I think we have defined the problem and all of its components, being the access to the healthcare system, developing the evidence for adoption, and the procurement that needs to encourage the scale and spread across the system. But it still is a very challenging problem to address all of these steps. So I'd say halfway.
Bill?
I don't know what this says about the difference between Neil and me. I quickly went to AA and said the first step in recovery is acknowledging you have a problem. So yeah, I agree with Neil. I mean, the important part of the question is than ever before, right? Because I do think that's true, and the story I told at the beginning about where we were 10 years ago is apocryphal for me, and Ross Wallace is somewhere near, he was working on this with us. I mean, it was literally as black and white as I described, and it wasn't that there's any shortage of smart, hardworking people, I keep using that phrase, it's true, who knew that something had to be done. And frankly, business-friendly governments, whatever that means, in different jurisdictions, it just couldn't get through the system. And when I realized this job was residing in health, and with the kind of cross appointments of the reporting structure that was assigned to it, I think that, that's a big start. The fact that you have full government support in the single payer system, and this is the other thing that's different, an economic imperative that didn't exist 10 years ago. I mean, I'm not an oil and gas guy, but I'm, certainly wouldn't be alone in saying it's different this time. And so the whole country benefited from that boom in Alberta, Saskatchewan, and Newfoundland and Labrador. It's not happening. So we need to find a different industry, and we are so teed up in Ontario, in the GTA in particular, for making this work. With this kind of support and focus, I think we are closer than ever before.
Okay, great. Matt has the microphone, so if you have a question, put up your hand, and do wait for the microphone. And, sorry, we have another microphone on the other side. Yes.
This is a question for the Chief Strategist. I was impressed by the trio of single payers in Ontario, job creation, and procurement. My question...
Maybe not on. Okay.
I'll try again.
Better.
That sounds... For the Chief Strategist. I was impressed by the trio you set out of single payer Ontario, job creation, procurement. What strategic thoughts have you about the existing and prospective free trade agreements? I'm thinking about the United States and Germany in particular, saying buy locally.
So for people who've heard me speak before, they'll start to smirk because this is a soapbox of mine. So this is where I, at some point, might get my wrist slapped. I used to practice trade law, so I wouldn't purport to give advice now. But what I do know is we are unbelievably conservative in this province in our trade law advice, unbelievably so. And in this job already, I've heard many people say to me, the lawyers have told us that. I was a partner at Tories, right? The first thing you learn is lawyers don't make decisions. What you do is give insightful advice, and the client makes the decision. So if the client is saying that the lawyer has decided, or the lawyer has told me, or whatever, all I know about that is you have put your point on the risk spectrum too close to conservative, because the lawyer's job is to give you that form of advice. Now, you're supposed to be the business person who provides the business insight. So, then I can give you a couple of stories. As we pat ourselves on the back for abiding by the letter of the law in a conservative way with all the various trade agreements that apply, I guess we take great comfort in that, and we can talk about it at cocktail parties or something. So in the meantime, we are paying, Canadians, our taxpayers are paying for the entire Detroit-Windsor Bridge, including the toll plaza on the other side of the bridge. The Americans are insisting we buy U.S. steel. So if you don't like that example, look at the Buy America policy. If you don't like that example, look at the mysterious way where French multinational companies seem to come up pretty consistently as the awarded recipients under French contracts in many industries, not just health. Think about meetings where I've sat in from a corporate side and been told by governments that, well, you shouldn't close that plant because your product will be delisted or your product will not get approved in our country. I was in Britain when there was a whole flack around the fact that the Bombardier plant would have to close in Bristol, I think it was, because they didn't get the rail car contract. And mysteriously, the next rail car contract that came out, Bombardier won. I mean, look at the jurisdictions of the states and municipalities in the United States. We put this in the wrong, we are too risk intolerant when it comes to trade law agreements. And I'm not a politician, but I would just say it'd be kind of interesting to be accused of fighting too hard to protect jobs in Ontario or to create jobs in Ontario. So I believe that the rule of law is important, and I believe that we must abide by our trade law agreements. And I believe we can do that and create jobs in this province in the health technology sector.